Hi everyone, welcome to another webisode of The Good Doctor on EasyLiving.com. Today I'm in the company of Rita Taylor from Anglo-Arabian Healthcare, and we're going to talk about all the diseases that we can pass from one person to another through a handshake, sneezing in front of someone. You might not think that there's viruses going back and forth, but there are. Stay tuned. So Rita, we're going to be talking about MERS, if I've pronounced it properly. For our audience, can you please tell us what it is and why should we be worried about it?
MERS is of concern just now because it's affecting this area particularly. It's called Middle East Respiratory Syndrome, and it has, of course, with respiratory signs and symptoms, coughs and colds and fever. It's of concern because this is a new disease. This is a disease that's had quite a few cases in Saudi Arabia. There's been a few cases in Al Ain and a few cases in Abu Dhabi. No cases is documented in Dubai, but it's concerned because it's something new and it can be easily stopped.
So when you say that it's a few cases, is it something that we should be alarmed and worry about, or is it something that can grow and become an epidemic?
We need to be alarmed and worried about it in the circumstance that we have to remind people about hand etiquette and hand hygiene. It is preventable, but it can rise to an epidemic if we don't do correct preventive strategies. We don't want to cause any fear or frightening of people in the general population, but hand hygiene for common flu, common cold, any of these respiratory diseases, people forget that coughing and sneezing is a basic thing that we all do, but we don't do it properly.
Now this has me raising various questions. This goes down to all kinds of people, from moms and dads taking care of their kids, children in school, laborers,
shopkeepers, bank workers,
cooks, people who cook food for us in restaurants.
Yes.
So what happens? Let's go through it. Give me a scenario.
Well, a scenario, if you have just a normal cough and sneeze, you want to sneeze, where do you automatically sneeze into? Into your hand.
Yeah.
And then what do you do with your hand? You either touch somewhere, or you shake somebody else's hand, or you touch a doorknob, and those viruses, those germs on your hands have now been spread onto the door handle. The next person comes along, they pick up that virus, and they touch the nose or they touch the mouth and they touch other parts of the body, and the virus enters. That's when it becomes a problem. So hand etiquette and coughing and sneezing, we need to learn how to do properly. When we're children, we're taught how to wash hands. As an adult, we forget quite often. One of the things that we need to know as well is cough etiquette and sneeze etiquette. These days, we shouldn't cough and sneeze into our hand. Cough and sneeze into your elbow. This is the correct way, because then if you go to shake hands, it's
then
the
you'll
germs
stop
are
the
here.
domino effect
Exactly.
from spreading the germs.
And having hand hygiene solution in your bag as well, that if you think you're in a situation where you've been exposed to viruses and people are coughing and sneezing, you know, use the hand sanitizer gel on your hands.
I'm glad you raised that. Now there are reports coming out that this hand sanitizer basically just spreads the germ even more.
No, if you do it properly, with the correct hand sanitizer, and there are certain steps, they call it 6-step technique. You have to make sure you do it properly. Because what a lot of people are doing, which is why they're concerned about spreading the germ, they don't do it properly. They just put the hand sanitizer and they just go like this.
Yeah, and then we think it's done,
and they think
we're clean.
It's done, exactly.
But it's not, is it?
It's not. You've got to go right into the palms of your hand, the surface of your hands, both surfaces in between your fingers. Don't forget your thumbs and also the tips of your fingers. It should take 30 seconds.
What should people be looking for in a hand sanitizer?
Good question. There are many good brands of hand sanitizer out there, but what we recommend as healthcare professionals is something that has got a higher concentration of alcohol in it. Now again, you have to go to something like 65%, and you can find them in all the counters. Boots, Marks and Spencer's, Woolworths, Carrefour's, Lulu have them, Co-op. You know, they're usually on the stand, and tiny little bottles, but one that has got a higher concentration of alcohol.
Let's say that we don't do this, and you talked about cases being found across the Middle East. What are the symptoms?
This is where it's a little bit worrying. It's general coughs and colds, fever. There are strict criteria, and the patient usually has had a previous pneumonia. Usually the patients are not healthy, you know, so they're more susceptible to these illnesses. Generally people that are fit and healthy, it's not a major effect, but that still doesn't prevent us from doing correct hand hygiene.
Brilliant. Well, thank you very much for this insightful information. For all of our viewers out there, if you've got any thoughts, comments, or questions about this subject matter, please leave them in the comment sections down below. And remember, after watching this video, wash your hands and take care of your hygiene. Thanks for watching The Good Doctor on EasyLiving.com, where you can find anything and everything lifestyle.